BSN Curriculum Project by Leo Ibarra. This PowerPoint is in partial fulfillment of the course in SG 575. The purpose is to describe an ideal BSN curriculum program based upon research. For my BSN program, the program structure and model I chose would be a baccalaureate type. The structure would be a 4-year program divided within 8 semesters. The model for this would include first an integrated baccalaureate program, which would have foundational courses within humanities, social, and health sciences for the first year. Following that, the remaining 3 years would include the nursing educational courses. An additional model option I would like to have would allow for a dual enrollment. This would allow for students currently enrolled in acceptable ADN programs who have also completed their prerequisite courses and satisfied the requirements of their ADN curriculum and completed the NCLEX examination and successfully passed. They would then be able to enroll for 5 more BSN courses, and once the rest of the requirements have been fulfilled, they would be able to obtain their BSN degree. The method of program delivery I chose was both traditional and hybrid online. For traditional, this is your typical program which would allow face-to-face instruction. It would include classroom lectures, labs, simulation labs, clinicals, and senior practicum options. For the hybrid online, this can include some traditional components. However, it would also include some web-based online approaches. It is a pedagogical learning approach, and it is both synchronous and asynchronous in regards to its simulations and labs. This would be a great choice for the ADN portion or dual enrollment portion previously discussed. Partnerships for my ideal BSN program would first be with the community and junior colleges. This is important because it would allow for the following of students who are currently completing their ADN programs to allow them to enroll into our dual enrollment BSN option. An additional partnership I would like to have would be with the local healthcare facilities and hospitals. This would be a great resource as it would provide students a real-life experience, and in addition, it would allow for additional clinical sites to be available. Lastly, an additional partnership would have to be with professional organizations, and this can include a number of different types of professional organizations from sectors of nursing and even just businesses that can provide scholarships or other supportive opportunities. Organizational strategy. I chose a concepts-based learning, teaching, and curricula strategy, which states that education is based upon understanding and building upon previously learned concepts. In addition, strategies are used by instructors to enhance the learner's role and interactions with those learned concepts. I also chose a building blocks design. For foundational knowledge, this is what students begin with. As they further progress, specialized material is provided, and additional knowledge is built upon the foundational knowledge that has already been taught. And then students can obtain more in-depth and specialized knowledge on top of that. The curriculum philosophy I chose was pragmatism. This is the integration of ideal and realism. Typically, I found this the most realistic for nursing students, as it would allow them to be able to participate in realistic expectations within the field of nursing, in addition to having ideals of what we would like for them to be and what they can become. Pragmatism teaches that change is constant and experience is realistic. The framework for learning would include labs, simulations, field experiences, community, and social activities. For students, the new information is learned, it is then interpreted, and then they are able to apply it to their clinical experiences. For the evaluation of learning, it is assessed by examinations and direct observations of interactions in clinicals. Typically, this would be when a clinical instructor is able to observe students interacting with patients. It is also when students are able to kind of evaluate themselves and discuss those interactions and those experiences as well. The learning theory and educational approaches I chose were first cognitive constructivism. This is active learning with student responsibilities for organizing and applying the knowledge that they got to learn. It helps support critical thinking and linking concepts and ideas. The knowledge is first constructed, it is then built upon the previously learned knowledge, and then this is enhanced by the learner's new experiences. I chose this to be a competency-based education. This allows for active learning and application of student knowledge and skills. Faculty and staff are able to provide guidance and support for students. The competencies are aimed towards satisfying curriculum outcomes. Course activities are clearly related to the competencies. And then the assessments are criterion reference, they're authentic, valid, and they're also reliable. The education is performance-based with the attitude that students will graduate with necessary knowledge, skills, and values that will serve them throughout their academic and their professional careers long after they graduate. Program goals and outcomes. For the program goals, I started off that students will be able to use critical thinking in providing safe, evidence-based, and patient-centered care. This will allow them to enhance patient and healthcare outcomes. Students will also be able to integrate technology to support their clinical decision-making and practice. Lastly, for goals, students will apply principles of prevention, health promotion, and professional role development. In regards to outcomes, we would be able to see that 80% of students will be able to pass the NCLEX on their first attempt. In addition, after graduation, 75% of our graduates will report a satisfaction with the overall program. Here we see the layout that I would have for the BSN program. And based upon research and the approaches, educational approaches, and also which also help support the theories regarding learning foundational pieces that also build upon each other. We start off with first human AP, chemistry, English 1 and 2, the social sciences, statistics, math, and microbiology. I believe this is a great point to start as it allows an introduction into anatomy and physiology, chemistry, and then also the microbiology. I believe those are great introductory courses. And then also social sciences, I believe those are a very, very fundamental piece of learning for students. As I mentioned, as we progress to year 2, we move into our basic foundational nursing courses, which would, of course, include fundamentals. It would also have pathophysiology, pharmacology, and health assessment. So in review of a few of these things, and also from my own experience, I found that pharmacology would be a greater advantage for students if they are able to have this before they have their more specialized courses. This provides a great introduction into medications, concepts of medications, such as basic definitions of onset, half-life, and the distribution and metabolism of medications. Things that would help them understand as they further progress learning. And of course, health assessment as well, which would allow students to first get the basic fundamentals of what normal looks like before they move on to some of the other conditions that we might see in the specialized year 3. So, as we progress, we see psych, older adult, or geriatric nursing is the older term for that. We also have pediatrics, OBGYN, MedSearch 1, and research. I think this is a great example, as previously mentioned, in regards to teaching students more specialized learning um, as they further progress into the program. Lastly, for year 4, we have our MedSearch 2. We have leadership, or a transitional type of course. We also have Farm 2, public health, and then special studies slash practicum. I believe the last would allow a great option for students who want to specialize in perhaps a certain field of nursing, such as oncology, or maybe even back to public health, but it would allow them the option to be able to do that. That is the end of the presentation. These are my references. I want to thank you for taking the time to listen to this presentation regarding my ideal BSN program. I hope you enjoyed.